welcome to Simple OT. My name is Sarah, and today I will be going over cardiac rehab. So just as a quick overview, cardiac rehab is a program designed to improve cardiovascular and cardiopulmonary functioning. It involves patient and family education as well as exercise. The goal of this rehab is to improve or restore heart health. And in cardiac rehab, there are 3 phases. The first phase is in the acute or inpatient rehab setting. Here, the MET levels start at 1 to 2, and you'll be working to improve your patients to MET levels 2 or 3. And you'll discharge your patients once they are able to reach 3.5 METs. The goal of the first phase is to work on ADLs and also to improve self-care skills. And this really aligns with the context of the setting that this phase is in. So once they're able to work at 3.5 METs, they'll be discharged to phase 2. And in this phase, you're gonna be in outpatient rehab settings. Here, the MET levels you'll be working with are MET levels 4 to 5. And the goal of this phase is to improve activity tolerance and while avoiding isometric activities. Truly, you're going to be avoiding any kind of activity that involves sustained contractions with holding your breath, because if a patient holds their breath, then they're going to increase the MET level demand. After phase 2 comes phase 3, which is in a community-based setting. This phase is largely considered a maintenance phase, and so the goal of which is to maintain functioning, and if the patient is able, you might also consider designing a home exercise program. This phase works with MET levels 5 and up. So, what are MET levels? A MET is a unit of measurement to describe the amount of energy it takes to do something. Factors that influence METs include age, weight, and also recent life events. If you think of a MET as 3.5 milliliters of oxygen per kilogram of body weight, naturally body weight is in the formula, and therefore the larger a person is, likely the more METs they will require to complete an activity as compared to a smaller individual. If you think about age, I like to think about when I was a kid. Now, when I was a kid, I was able to do all these different activities and sports and run around with my friends without getting tired. You could do all these things and more and still come back home with a boatload of energy. Versus now, as an older adult, sometimes we get tired just doing simple activities. Perhaps bringing the groceries in from the car is all that it takes to fatigue you these days. Also, life events. You might consider a healthy, normal heart, one that is functioning as expected and functioning very regularly, is going to require a lot less energy as opposed to a heart that is broken, a heart that just had surgery, or a heart that is recovering from a major event. So, taking a deeper look at MET levels, here you have your MET levels, and each MET level is associated with a MET level stage. So to start off, we have stage 1, which includes MET levels 1 to 1.5, which is primarily lying down, doing a sit-to-stand transfer, or just reading a book. If you laid down in your bed and did absolutely nothing, just laying there, you're going to take up 1 MET. Stage 2 involves MET levels 1.5 to 2, which is just a little bit more activity than the previous stage. So you might consider grooming or shaving or doing a seated sponge or wet wipe bath. Moving on to stage 3, you have MET levels 2 to 3. Here at MET levels 2 to 3, you are able to get dressed, or you're able to sit down in a warm bath, note warm, because the hotter the water, the greater the MET level. So sitting down in a warm bath is going to be within this MET level. And then also writing and typing. With writing and typing, it's going to be pretty much any activity that you're sitting at a desk for prolonged periods of times. Maybe you get up and down to take breaks, go to the bathroom, etc. But all in all, you're pretty much just sitting there doing an activity. Stage 4 involves MET levels 3 to 3.5. Here you have standing light ADLs and IADLs, such as a standing shower, perhaps doing some light cleaning, including dusting. Stage 5, you'll have 3.5 to 4 METs. Here you're able to do even more standing IADLs, such as standing to wash the dishes, standing to do some laundry, or even make your bed. And then lastly, at stage 6, it's MET levels 4 and greater. Here you're going to have your basic home management stuff. You're also able to do some light calisthenics. And obviously, it's kind of a weird setup because you have 6 stages and then 2 of which have like 1 MET level, if that makes sense. So the way I think about this and the way I remember the stages and the METs is that you have METs 1, 2, 3, and 4. Now, MET levels 1 and 3, those are odd numbers. And so because they're odd numbers, they're very odd, they're very strange. They're going to have a unique way of breaking up the section. So if you remember that numbers 1 and 3 are odd numbers, you'll be able to remember that 1 and 3 are broken up into odd categories, meaning there are 2 sections for these levels and these levels alone, versus the even MET levels such as 2 and 4 are just that. They're just 2 and they're just 4. They only have 1 stage at each of these levels, versus the odd numbers, they have 2 stages. Hopefully that helps you remember them. Another way to remember all of this is to think of MET levels as a story. So if you were to imagine yourself in stage 1, where you're sleeping, your alarm goes off, you roll over in bed, and you decide to start your day off with a good book. So while you're laying there, you're reading your book, you're only taking up 1 to 1.5 METs. Now, the alarm goes off again, it's really time to get up. And so you sit up in bed, you put your book down, and you notice all that reading has caused some pretty ridiculous bedhead. So you brush your hair, you bring out your hairbrush, and you start detangling your messy hair, which takes 1.5 to 2 METs if you're sitting down in your bed doing all this. Moving on to stage 3, you have to start getting ready for your Zoom class. So you put on your pants, you're sitting down, getting dressed, and then you go over to your desk in which you start your computer and you start getting to work and you start your Zoom class. This takes up 2 to 3 METs. Moving on to stage 4, after sitting in class for a long time or sitting in your meeting for a long time, you realize that your desk is disgusting. And so you pull out your duster and you start dusting your desk and cleaning it. And it takes 3 to 3.5 METs to clean your desk with the duster. Once you clean your desk, you turn around and notice that your bed is filthy. Here at stage 5, you're going to take 3.5 to 4 METs to make your bed and clean up your Zoom background. Once your bed is nice and neat, your room is clean, and your meeting or your class is over. At stage 6, you are able to put on some yoga that you like to do on YouTube with your nice and clean computer, roll out your yoga mat, and do some light calisthenic works and yoga. Contraindications and considerations within cardiac rehab include cardiac and sternal precautions. If you think about phase 1, you're going to be in the hospital, and so naturally you're going to have these precautions, especially sternal precautions if they'd had surgery, right? And so cardiac precautions primarily relate to doing an activity warm up. You might have heard the phrase warm your engines. This just essentially refers to warming up or pacing yourself during activity and not just jumping out of bed and doing a full sprint, right? So sternal precautions include you're not supposed to lift your arms over your head, You're not supposed to lift your arms over your head or behind your back. You're not going to push or pull or lift over 5 pounds. You're not going to do anything that stresses your sternal incision. Also, if the patient has chest pain or nausea, or perhaps they're throwing up or complain of shortness of breath, you want to stop what you're doing. Those are warning signs. Those are not ideal situations, and monitor them and stop what you're doing. Also, if the patient complains of dizziness or fatigue, check the vitals. You should be doing this anyway throughout the rehab session, especially if they have a cardiac event or a major surgery, right? So they often say doing it 4 times throughout the session is the minimum. So if you think about once before activity, once second during the activity, third maybe halfway through the activity, and then fourth being the last thing right after the activity, you're going to be checking it 4 times at a minimum. And if they complain of dizziness or fatigue, check it more, check it again. Better to be safe than sorry. So the blood pressure should not be higher than 200 over 120 at rest, or decrease by 20 points systolically. And the oxygen levels should not be below 90 for cardiac patients. And for pulmonary patients, it's more like 86, so mid to high 80s. Now, the major takeaways here. So if you take anything away from this presentation, just remember that 1 Met, you're laying down. 2 Mets, you're sitting. 3 Mets, you're standing. And 4 and up, you're going to be standing with activity. This is majorly simplified, but it's a great way to simplify it in your brain and for the exam or for a patient, right? Also remember that phase 1 of cardiac rehab's in the hospital, phase 2 is outpatient, and phase 3 is in the community. All in all, just consider the vital signs and also the precautions. Review the activity guidelines cleared by the surgeon, and if it's over 3.5 Mets, especially in a question, if it's over 3.5 Mets, note that the patient can be assumed to be discharged from the hospital and out of that phase 1 cardiac rehab stage. As always, you know more than you think and trust your gut. In this case, maybe you want to follow your heart.